Hello everybody. Today in this episode we'll be talking about infertility and how much contribution the male is giving towards this. Let's hear it from Dr. Sunil Ishwar. So what is male infertility?
When we investigate regarding the infertility, both male and female are investigated. If we find any problem in terms of semen analysis, in terms of the sexual intercourse, then we call it as male contribution towards infertility, and which is broadly called as male infertility.
How common is male infertility?
When we investigate, we say 30 to 40% contribution from the female side, 30 to 40% from the male side, and around 20 to 30% we call it as unexplained. So, broadly speaking, it's 50-50. Both male and female are equally responsible for infertility.
Can a healthy looking man still be infertile?
Yes, healthy looking men can also carry male factor for infertility. Looks really doesn't matter.
What is the most common cause in male infertility?
When you do semen analysis, we find the count, motility and morphology to be reduced, which we call it as oligoacetoteratospermia. Most of the time, it is a non-specific condition, not necessarily that they are having any problem to result in oligoacetoteratospermia.
Is male infertility permanent?
Depends on what is the condition of semen and the sexual intercourse history. If the count is absolutely zero, there is a small segment of male where the count is absolutely zero, and even in this absolute zero, there is around 20-30% of the men where we can tell that it is very unlikely that they can conceive or they can have a natural offspring of their own.
When should a man get tested?
Any couple who is coming for fertility treatment, men has to be tested. And even if the report comes normal, we like to repeat the test once in 4 months to see if there is any variation or any abnormality is coming.
Does age affect male infertility?
Yes, age definitely affects male infertility, but in a later age. We say in a woman, any woman over 35 is a difficulty to conceive. In men, we say above 45 or 50 years.
Can lifestyle affect fertility in men?
Yes, this is one of the most important factor when we say we do not know a reason why your quality of the sperm or the semen analysis is looking abnormal. We feel that it is more to do with the lifestyle. Lifestyle involves lots of things. Anything which contributes to your stress, anything which contributes to your sleep, anything which contributes to your abnormal health habits can lead to abnormal semen factors.
Is male infertility treatable?
Most of the male problems or infertility related problems can be treated. If you say, give me a number, I would say almost 95% of the male problem can be treated and they can have their own healthy offspring.
So what are the symptoms of male infertility?
You don't need to have any symptoms to call it as a male factor for infertility. Yes, but if you have any erection problem, intercourse problem, we know that okay, there is problem. Yes, less volume of the semen whenever the ejaculation happens, that is also one of the indication for lower sperm parameters. Otherwise, most of the male related infertility problem, even if the volume of the semen is good, erection is good, intercourse is happening normally, still can have a infertility.
Can low sperm count cause symptoms?
Low sperm count symptoms as such may not be there, but low volume can be seen easily. Anytime we are having ejaculation, you can see the volume low. But low volume does not mean the count is bad. So we should always get it examined. Generally, there are no symptoms.
What is a varicose?
If you look at the architecture of the male testis, it is located outside the body so that the testis is in a lower temperature than what the body's temperature is. And the blood flow is also in a limited way. But when the blood flow increases to the testis or the veins to the testis increases, then it gets more heated up. If you look at the male architecture of the testis, which is located outside the body, that is the sole reason is to keep the testis in a lower temperature. There are certain blood vessels which supply to the testis, but if there is increased blood flow or the venous system is more, there is stagnation of the blood which would heat up the testis, in that way causing damage to the sperm. Most of the time it is damage to the morphology, then next is the motility, and over a period of time even the count reduces. So we can grade this vascularity by telling which grade of varicocele. We say grade 1, grade 2, grade 3, grade 4. When the varicocele is grade 3 and above, it causes more damage. Varicocele grade 1 and 2 are not known to be associated with severe abnormality of the sperm, but grade 3 and above can be associated with abnormal sperm parameter.
Now let's discuss some of the most common causes for male infertility. Can infections affect fertility in males?
Yes, there are many types of infection which can affect the fertility in the male. It could be infection in the prostate, it could be infection in seminal vesicle, it could be testicular infection also. Very rarely tuberculosis, which is very known in India, and if you have had a childhood mumps can cause orchitis, which can completely destroy the production of the sperms.
Can obesity impact fertility in males?
One of the most common and most of the time neglected factor is the overweight or obesity. You don't have to be clinically very obese. Even an overweight can be a reason for decreased count and motility. Shall I explain how it works? Yes. With increased weight, there is increased pressure to the lower pelvis. So there will be increased stagnation of the blood flow from the testis, and also there is increased heat. As I already explained, when the testis is getting more heated, then the count, production, motility, morphology, all are affected. So weight really plays a very large role in the semen parameter.
Can diabetes affect male infertility?
In the initial stage, diabetes generally does not affect, but if the diabetes is uncontrolled and if the male is having diabetes for a very long time, definitely their count motility is less. That's why whenever we screen for a male infertility, we also look for the sugar levels. If the sugars are high, we ask them to control it. If there is a very tight control of diabetes, definitely it will not affect the male parameter.
Now, how does lifestyle affect male fertility? Let's talk about stress.
Stress is one of the major contributors, but unfortunately, we do not have parameters to measure stress. It could be your work pressure, it could be your travel pressure, it could be your deadline pressures, it could be your sleep. So, stress definitely contributes in a large extent.
What about smoking and alcohol? How does it affect male fertility?
Smoking affects the functionality of the sperms. Now you can just imagine what we say. Top athletes, they say no smoking, no drinking. Why? Because it affects your performance. Similarly, anyone who's been regularly smoking, it affects the functionality or the performance of your semen.